I'm John DeRocher, who I guess basically coordinated the grant project. We have Dr. Mutai, who was here as a hospitality and tourism management professor, and then Dr. Ladwig, who just joined us actually in July. So he helped to write this grant in advance of when he actually started his position here. Luckily, we received notification on June 3rd that we were getting the grant. It's basically implementing Life Simple 7 from the American Heart Association in Northwest Indiana. So we're trying to work with community members from either Lake or LaPorte counties. So the Lake County individuals and the seminars that we'll do here and the screenings that we'll do in Lake County will happen right here in the Research Center. And then for the LaPorte County, we're going to use Healthcare Foundation of LaPorte. So right in downtown LaPorte, we will be doing our educational seminars and screening sessions there. You guys want to? So I guess I'll say it from the Life Simple 7, I'm leading the managing blood pressure and reducing blood sugar topics. And so those are the two educational seminars that I'll deliver. I'll be helping with all the screenings. I'll have Dr. Ladwig take over, I guess.
Yeah, so this is really an important topic for Northwest Indiana because it's particularly, we see particularly high levels of heart disease and other diseases and other health issues in this area. So this outreach is really important to help educate people to try to address these issues in their lives. I'm a behavior change specialist, so I do psychological interventions to change behaviors. So I'll be focusing on trying to educate people on how to be more active, how to quit smoking, and how to maintain or lose weight.
Great. I'm Ezra Mutai. I'm an assistant professor of food and nutrition in the School of Hospitality and Tourism Management. So as my colleagues have already mentioned, this is really an important topic whenever you look at cardiovascular diseases. It's definitely related to diet. So some of the topics or seminars that I'll be leading includes, how to eat better, how to kind of try to regulate your cholesterol levels just by making sure that the nutrients that you're having are really beneficial to your heart health, and just making sure that people are aware of the different principles or ways they can use to improve their diet. So I'm excited to be part of this particular research project.
Then just ask one prompting question. As far as the screening element, I would love to hear a little bit more about how the screenings you're going to offer both in Lake and the LaPorte counties.
Yeah, so we have a variety of instruments that are pretty portable, so that's very nice. So we can easily use them here or move them to Healthcare Foundation of LaPorte. So for example, for the blood pressure, I have automated blood pressure cuffs. I have 2 of those that we use for research all the time, and it's pretty portable. They're on wheels. I can show you those here shortly. But we can do blood pressure screenings. For blood sugar and for the cholesterol, we'll be using a Cholestech system. So it's a very portable system that we can do a little finger poke blood sample, 40 microliters. Then in 5 minutes, it gives a little printout to tell the total cholesterol, glucose concentrations, HDL, LDL, and triglycerides. So all of that's printed out on a nice little sticker. As part of the grant, actually, we're purchasing a couple of new items. So related to the weight loss, we have a body fat scale. We have one down the hall we can show you, but we're getting another one that we can keep over at the Healthcare Foundation of LaPorte, which it gives you a nice little color printout for basal metabolic rate, overall body fat and muscle content in each limb, body water content, so it's pretty detailed. Going back to the blood sugar before I forget, overall blood glucose regulation in the past 3 months or so is usually estimated by hemoglobin A1C. So we're getting a nice little desktop Affinion analyzer that can give us the printout for hemoglobin A1C. So if anybody thinks they have an issue with blood glucose regulation, or if they have a suspicious test from the Cholestech, we can use the Affinion then to give the hemoglobin A1C values. Dr. Ladwig will be involved with getting people more active or improving activity levels. So we'll be giving away a lot of these things. We'll be giving away materials as well. So like we'll have resistance bands that people can take home and use. We'll have what else are we having? Free blood pressure monitors that people can take home and use. Pulse oximeters, pedometers for step counting. So a variety of different things like that. So I think that kind of overviews, other than the smoking cessation, which you're leading. But
yeah, well, nothing to take home from that one, unfortunately.
So.
One other question. So I know you mentioned that you're going to be working with health professionals in LaPorte County and Lake County. Are there other ways you're going to have events so people are aware of the work you're doing, or how are you going to engage the public?
Well, so variety of ways. Dr. Ladwig's helped to lead that, and same thing with Grant, our coordinator. They've pushed out some advertisements with some of the schedule and everything, QR codes, so it's easy to scan. We do have a budget also to mail things to people, so maybe after the story comes out, if it comes out in the newspaper, then we can start to mail things to people as well if they want it that way. But it's already gone out to our social media feeds from the campus, so to Twitter, Instagram, those types of things. So hopefully that'll help to improve the awareness. I'm sure the Healthcare Foundation of LaPorte will also help us to advertise in LaPorte County, which should be beneficial. So there's two components to this. I mean, the primary component is to just offer the educational seminars and free screenings every Friday. We'll alternate between Lake and LaPorte counties. But there is also a research component that people could choose to participate in, which they would come in before the educational seminars start, and we basically would screen for all the Life Simple 7 components. For instance, the resting blood pressure, 3-day dietary surveys, cholesterol, glucose, all those things would be screened before, and then we would have them attend as many of the educational seminars as possible, and then come back at the end of the program, and like either in the fall or spring, and then retest. And so the idea is hopefully people that come to more of the seminars would have a better response than people that attended fewer seminars. So there is an opportunity to be tested before and after the entire 7-week program basically. And we'll be running one cohort starting here within about a month that would finish in early January, and then starting again in mid-January through May. Is that correct? Mm-hmm. So we'll have 2 cycles within the year.